This resource is to assist you to convert the three-dimensional anatomy that you see in the wet labs and when dealing with patients or clients into 2 dimensions that we need to interpret on plain film imaging in the form of X-rays. These images are made when radiation is emitted from a source. Think of it as a camera, passes through the patient and hits the film, which is placed by the radiographer on the opposite side of the area to be imaged. The radiographer will use their knowledge to place the film and camera in positions relative to this body part in order to produce the best image for the radiologist to interpret and to arrive at a radiological diagnosis. This best image gives the most information about the structure of interest. Just like a good photograph, it needs to have good resolution, which means it shouldn't be under or overexposed, although like digital photography, some corrections can be made post-production. The most common views in musculoskeletal radiography are antero-posterior or postero-anterior and lateral views. They are named by the direction of the X-ray beam from the camera to the plate. So for example, in this schematic you can see the positioning for the postero-anterior view of the chest, with the patient facing away from the camera and the film plate positioned in front of their chest. An antero-posterior view of the shoulder is performed with the patient facing the camera. When the patient can't stand or the particular view requires it, the patient is positioned on an X-ray bed into which the film is placed, and the emitting source is swiveled to place it accordingly. There is also a wide range of specific views that the radiographer captures to investigate particular pathologies. X-ray images are comprised of shades from bright white through grey and to black. If the radiation hits the film without a body part between, the resulting image would be pitch black. When the radiation is absorbed by the body on its way through to the film, it casts a shadow on the film, and the more radiation it absorbs, the whiter the image. So bone and teeth, the most dense parts of the body, image is relatively white. They are radio-opaque. Air does not absorb radiation, so air-filled cavities such as the lungs and intestines image much darker, so they are relatively radio-translucent. Most of the rest of the body, the muscles, tendons, blood vessels, etc., contain fluids, so they image grey and consequently are not well distinguished from each other on X-ray. If it's important to image these anatomical structures, other forms of radiological imaging, such as computed tomography, known as CT, magnetic resonance imaging, known as MRI, or ultrasonography, are superior. In the introduction to this resource, you will find a basic explanation of how to look at musculoskeletal X-rays and what limitations they pose in the diagnosis of musculoskeletal conditions.